Frequent urination is, well, a pretty common concern. It's something that many people experience at some point in their lives, and it can be caused by a variety of factors. It means needing to urinate more often than usual, which can sometimes feel inconvenient or even disruptive. What's considered frequent, though, can really vary from person to person. For some, it might mean going to the bathroom every hour, while for others, it could be a few extra trips during the day. It depends on your age, your fluid intake, and your overall health. For instance, drinking a lot of water or consuming diuretics like coffee can naturally increase your trips to the bathroom. Most adults urinate about 4 to 8 times a day, and this is generally considered normal. However, this number can fluctuate based on lifestyle and habits. But some people might urinate more or less often, depending on their individual needs. For example, athletes or people who sweat a lot might urinate less because their body loses water in other ways. Frequent urination can be bothersome, though. It's not just about the inconvenience. It can also be a sign of an underlying issue. It can disrupt your sleep and interfere with daily activities, making it harder to focus or enjoy your day. There are several factors that can contribute to this, such as infections, certain medications, or even stress. Understanding these factors is honestly so important. It helps to figure out the underlying cause and, of course, the appropriate treatment. Sometimes simple lifestyle changes can make a big difference. If you're worried about frequent urination, it's always a good idea to consult a doctor. They can help rule out serious conditions and provide clarity. They can help you understand your symptoms and recommend the best course of action for you. Remember, addressing the issue early can lead to better outcomes and peace of mind. Or alcoholic beverages can lead to increased urine output. Even habits like drinking a lot of water before bed can contribute to nighttime trips to the bathroom. There are several medical conditions that can contribute to frequent urination. Diabetes is one of them. In diabetes, the body struggles to regulate blood sugar levels. High blood sugar can lead to increased thirst and, as a result, increased urination. This is the body's way of trying to flush out excess sugar. Kidney problems can also be a cause. The kidneys are responsible for filtering waste from the blood. When they're not functioning properly, they might not concentrate urine effectively, which can result in increased urine volume and frequency. Other medical conditions linked to frequent urination include interstitial cystitis, prostate problems, and pelvic organ prolapse. Certain lifestyle factors can contribute to frequent urination. These factors can often be modified to help alleviate symptoms. One significant factor is fluid intake. Drinking large amounts of fluids, especially close to bedtime, can lead to increased urination overnight. Certain beverages can also exacerbate frequent urination. Caffeine and alcohol are diuretics. Diuretics promote urine production. Limiting consumption of these beverages may help reduce urinary frequency. Pregnancy can also cause frequent urination. As the uterus expands, it puts pressure on the bladder. This pressure can lead to a feeling of needing to urinate more often. This is especially common during the first and third trimesters. Diagnosing the underlying cause of frequent urination is crucial for effective treatment. A healthcare provider will start by taking a detailed medical history. They will ask about your symptoms, including how often you urinate, the volume of urine, and any associated symptoms. A physical exam may also be conducted. This may include a pelvic exam for women and a digital rectal exam for men. Urinalysis is a common diagnostic test. It involves analyzing a sample of your urine for signs of infection, blood, or other abnormalities. Other tests may be recommended depending on the suspected cause. These may include blood tests, imaging scans, or a cystoscopy. Treatment for frequent urination depends on the underlying cause. A thorough evaluation by a healthcare provider is often the first step in determining the best course of action. This may include a physical exam, urine tests, or even imaging studies to identify any underlying issues. If an infection is present, antibiotics may be prescribed. These medications target the bacteria causing the infection, helping to alleviate symptoms and prevent complications. It's important to complete the full course of antibiotics as directed by your doctor. For overactive bladder, medications that relax the bladder muscles may be recommended. These can help reduce the urge to urinate frequently and improve overall comfort. Your doctor may also discuss potential side effects and monitor your progress. These medications can help reduce urinary urgency and frequency, providing much-needed relief. Following the prescribed dosage and timing is crucial for optimal results. Lifestyle modifications can also be helpful. Simple changes in daily habits can make a significant difference in managing symptoms and improving quality of life. Limiting fluid intake in the evening, avoiding caffeine and alcohol, and staying hydrated during the day can help regulate bladder activity. These adjustments can be particularly effective when combined with other treatments. Maintaining a healthy weight through regular exercise and a balanced diet can also contribute to reducing symptoms. Excess weight can put additional pressure on the bladder, so weight management is an important factor. Pelvic floor exercises, such as Kegels, can strengthen the muscles that support the bladder. These exercises are simple to perform and can be done at home or with guidance from a physical therapist. Strengthening these muscles can improve bladder control and reduce urinary frequency. Consistency is key to seeing long-term benefits from these exercises. In some cases, surgery may be necessary. Surgical options are typically considered when other treatments have not provided sufficient relief or when structural issues are identified. This is typically reserved for cases where other treatment options have been unsuccessful. Your healthcare provider will discuss the risks and benefits of surgery to help you make an informed decision. While frequent urination is often benign, it's important to be aware of warning signs that require prompt medical attention. If you experience any of the following symptoms, seek medical care immediately. Blood in the urine, pain or burning during urination, inability to urinate, fever, chills, or back pain. These symptoms could indicate a serious medical condition that requires immediate treatment. Remember, this information is for educational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any health concerns.